Oh, where am I? Where am I? There we go. This is chapter 23 on pregnancy and development. So we don't get to sing a penis-vagina song, but maybe we can sing a placenta song. Placenta! 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 Not the same effect? No. Oh, well. You'll learn about the placenta later. Psh, don't worry about it. Let's talk about menstruation first. Yay! Well, not yay for the ladies, but yay for the guys because they get to learn about it and they don't have to do it. So these are cyclical changes of the endometrial lining where they get sloughed off and then they get reproduced, and they get sloughed off and then they get reproduced. Maybe that's a new dance. And this is due to cyclical levels of estrogen and progesterone. And let's talk about how it works. So menses first is the when the endometrium is sloughed off, where you have your bleeding, your period if you like. The proliferative stage is regeneration of the baseline endometrial layer. And then the secretory stage is when the endometrium increases in size and gets big and ready to implant. That big red pillow, as I describe it. So let's look at the next two slides here. These are hormone levels and tied to what happens with ovulation and the endometrial lining. So let's look here. This is one of the more important slides and the more complicated or confusing. So LH and FSH here on the top come from the anterior pituitary. The FSH has higher levels or goes up initially, and that promotes or prompts the follicle, the follicular cells around the primary and secondary oocyte to develop. And the follicle gets bigger and bigger and bigger. And then at this point, this is around day 10 to 14, you get what's called an LH surge. And this LH surge is actually in response to increasing levels of estrogen. So estrogens go up, LH surge occurs, and that triggers or causes ovulation. Now, women who are trying to get pregnant can measure their body temperature every day and look for when their body temperature increases by 1 degree or so. And at that point, the increase in temperature is caused by the LH surge, and the woman knows that she's ovulating, and she calls the man that she wants to be the dad, I guess, and says, "Hurry over here, we need to have sex." And that's exactly how it works. So you get your LH surge, and then LH and FSH slowly start to decline, and progesterone starts to go up as estrogen levels fluctuate, but then also decline. Progesterone and estrogens help to maintain the pregnancy, and we'll talk about that in a second. So if you notice this sort of midline here, we'll describe as ovulation, and on the right here we'll describe as menses. You can see here with the growth of the follicle, here we have ovulation around day 14, right in the middle. So this is the 14th day since your previous period started. And then as the hormone levels start to decrease, estrogen and progesterone specifically, the corpus luteum also slowly decreases. The corpus luteum's job is to secrete these hormones, the estrogens and progesterones, to maintain the pregnancy, specifically progesterone. This structure, these follicular cells that are left behind, does that. And as it degenerates, so do the levels of progesterone, and then you will trigger menses. As this degenerates, if the ovum, the egg, has been fertilized, then the now zygote, as it's called, will take over and start to produce a chemical that we'll talk about called HCG, which will help to maintain its own pregnancy. You'll also notice here that here we have the end of menstrual flow and then the beginning of the redevelopment. Here you have the proliferative phase, kind of the baseline foundation being set again, and the secretory phase where all the blood vessels get enlarged and bigger and preparing for implantation of the embryo. Okay, so the ovaries, as we mentioned, they produce estrogens. Specifically, the follicular cells help to produce estrogens, and they also cause secondary sex characteristics, which includes enlargement of the accessory organs, development of breasts, the appearance of pubic hair on the top, that is normal, and increase in fat beneath the skin. So women start to carry and get fatter as they go through puberty, largely tied to increasing levels of estrogen. Widening and lightening of the pelvis. Widening simply means the hips get wider, essentially. That's normal and healthy. So girls, before they've gone through puberty, tend to be more straight-lined in their body, and as they've gone through puberty, now their hips get wider and they have the more typical hourglass figure, which is normal and healthy. And then they also begin menses. Typically, menses will begin a couple years after puberty has started. Progesterone came from the corpus luteum. You'll notice progesterone is from the corpus luteum, and estrogens you'll see here were from the follicular cells, from different spots. And this is why estrogens are higher initially, and then they disappear as the follicular cells become the corpus luteum and now starts to produce progesterone instead. And this progesterone, the levels continue until the LH levels decrease, so they're closely tied together. And then you would have your menses if LH and progesterone levels disappear. Helps maintain the pregnancy, as we mentioned, and this is the basis for birth control pills. So birth control pills work by manipulating the concentration of GnRH, or gonadotropic releasing hormone, which has direct effect on the pituitary gland, and its release of FSH and LH. So birth control blocks GnRH and causes it to turn down, essentially, not blocks it, but causes it to decrease in level. So you have less production of FSH and LH, and thus you essentially don't ovulate. Most birth control pills prevent the woman from ovulating altogether, and she doesn't release an egg and no ability to get pregnant. It works in about 99.7% of the time, I think I looked up. Sometimes women still can get pregnant while on birth control. It happens, not often, but 0.3% of the time. Breasts, mammary glands, so they're present in both sexes. Yes, men, you have them. Can you lactate? We can find out. You let me know. They're modified sweat glands, although they don't produce sweat, they do produce milk. And they're stimulated by the sex hormones, mostly estrogens, to increase in size. So this is why women, as they go through puberty, their breasts enlarge, and they're preparing to produce milk, essentially. Now, when the baby is born, the baby will suckle on the nipple, and there's a lot of nerve endings in the nipple that will trigger the brain to start not only to be releasing the milk-producing hormone. Why I'm blanking on that, I don't know. And oxytocin. So you produce milk and you're preparing to release it. So the milk is produced. Here you have, first of all, the areola is the change in coloration. And then the nipple protrudes out from that. The lobes or lobules that you see here are the milk storage. They are all throughout the breast. And within the lobules, you have alveolar glands, as it's called. That's the actual glands that secrete the milk itself, where it's then stored in the lobes. And then the lactiferous ducts help you to lactate by carrying the milk out through the nipple and to the baby. On to stages of pregnancy and development. So fertilization, egg and sperm meet. They have a good time, a party. Yay, we made a baby. Then we have embryonic development. Following embryonic development, it becomes a fetus, and you have fetal development, and finally you have parturition, or childbirth. So fertilization, the oocyte itself lasts up to a day or so after ovulation till it has to be fertilized. The sperm can last for anywhere from 1 to 4 days, 1 to 2 days, but sometimes more. 48 hours is not the shortest. Sometimes it can last longer, but this is after ejaculation. And then the sperm, again, must make their way all the way through the vagina, the cervix, the uterus, and up into the fallopian tubes if they're going to fertilize the egg. So here's essentially how fertilization works, and it's different in different organisms. In humans, the oocyte has receptors on its surface, and when the sperm swims by, the head binds with these receptors. And the receptors pull the oocyte in into the actual egg itself, and then sends essentially an action potential all the way around the membrane of the cell, preventing any second sperm head from entering, so that you don't get polyspermy, as it's called. Usually if polyspermy happens, it causes a spontaneous abortion. It doesn't develop. But sometimes polyspermy can cause twins, where you have 2 different sperm fertilizing the same egg and then the egg splits, or 1 sperm fertilizing 1 egg and then the zygote splits. After the sperm goes in, once again, we already mentioned before, the oocyte will undergo the second meiotic division to become the ovum, where it was previously the secondary oocyte. And then the nuclei of the sperm and the oocyte combine to form what we call a zygote. Zygote is that one single cell that will become the adult. Okay? It's the result of fusion of the DNA from the two, and it begins mitosis really fast, all the time. While it's in the uterine tube, and then it makes its way into the uterus, gains nutrients, and hides in the big bloody pillow. The blastocyst is basically a ball of cells. We're at about the 100, 120 cell stage. It looks like this on the bottom right that you can see. This is the real picture of it, and this is what it looks like in cartoon. The outside of it is called the trophoblast. The inside of it, the liquid here, this cavity is called the blastocyst. And this region here of the cells, these are the cells that are going to become the baby. The cells on the outside, the trophoblast, are going to become the amniotic sac. This inner cell mass has all the cells that will become the actual embryo and the adult in the end. When you read or hear about stem cells, specifically embryonic stem cells, those cells came from isolating this inner cell mass and growing it out in a dish. And in fact, you can even take one cell from the blastocyst and grow it up in a dish and leave the other cells intact, and it'll develop into a normal adult. This, of course, hasn't been done in humans. It has been done in other animals and does work. Now, one important thing to note is that the blastocyst actually secretes HCG, or human chorionic gonadotropin. And the HCG triggers the follicular cells to become the corpus luteum and to continue producing these hormones, specifically in its control of LH and thus progesterone and so on. So it maintains the pregnancy. As the corpus luteum degenerates, the embryo takes over through HCG and so on and maintains the pregnancy. Now, P-sticks, or P-tests, I should say, pregnancy tests, work through HCG or gonadotropin. As the embryo develops, it starts to produce more and more human chorionic gonadotropin, and as a result, some of that gets into the mother's bloodstream, and gets filtered out through the kidneys into the urine, and so the mother starts peeing out increasing levels of HCG. Usually, it's right around the time of your when you would have your next period, that there's enough HCG there to detect it in a P-stick. Sometimes a few days before, but that's the basis for how it works. We already mentioned those other things. Placenta. So the placenta is a structure that grows between the mother and the embryo, and it both helps to deliver nutrients and to remove wastes. It also, which is very important, becomes an endocrine gland, and it takes over for the corpus luteum. So as the placenta begins to grow, this is a few weeks to a month after fertilization, now the placenta has grown and starts to produce estrogen and progesterone and maintain the pregnancy, as the embryo itself slowly stops production of estrogens and progesterones, and the corpus luteum slowly starts to disintegrate and disappear. So the placenta then takes over. It becomes an endocrine gland. What does it look like when a woman gets pregnant? Not when. After she's pregnant. I'm sure you can imagine what it looks like when she's getting pregnant. Awkward. So pregnancy is from conception until birth, and a whole lot of changes happen. Enlargement of the uterus, that seems obvious. Accented lumbar curvature, it's like the beer belly where you get this curvature, as you know, lordosis, that we learned a long time ago. And then the pelvic ligaments and the pubic symphysis relax, so they're more stretchy and so on. Women often feel good if they had joint pain or anything beforehand. It's relieved because everything is looser and feels happier. It's due to actually an enzyme called relaxin that gets produced. I know, strange name for that. And then often the woman will get morning sickness, typically in the first trimester, because of elevated progesterone. Morning sickness is a sign of health of the baby. It's a good sign. You want high levels of progesterone because that means the baby is being well taken care of. If you don't have morning sickness, that's, I suppose, less ideal, but maybe a bit debatable if you ask different people. Heartburn is also common because you got so much crap now in your belly that all the stuff that was formerly your belly gets pushed up into your chest, and that includes your stomach and so on, and you start to get some stomach acid coming up. Constipation, you get compression of the colon, the large intestine. There's a big baby in there, and it's harder to push the poop out of a smaller tube. So motility, the movement of the feces through the digestive tract, is slowed down. You start to pee more often. Kidneys have more fluid that they're going through because the baby is also a burden. The baby's not a burden, but the baby is asking for more nutrients, including water. So mother has to take in and retain more water, and thus she's going to have to pee out more. In addition to the fact that she's not only peeing out more, but she's peeing more often because the baby is in the way of the bladder. It compresses the bladder, and there's less room for the bladder. She can sometimes get congested and start to have a runny nose even when she's not sick. with the respiratory system, largely due to the increase in blood pressure. Vital capacity and respiratory rate increase, so she's able to breathe more quickly and more deeply, use more of her lungs. Body water rises, I mentioned that. Blood volume is going to increase 25 to 40%. That's quite significant. Blood pressure, thus, of course, will increase, and pulse will increase to move the blood around. And then varicose veins are also more common. It's harder to get the blood back up to the heart. Then we get to parturition, or childbirth, which you've all seen in various movies and so on, like Knocked Up. So what happens? Estrogen levels rise. They go up very high, and then the uterine contractions begin. The placenta starts to release prostaglandins, which themselves also trigger uterine contractions, and then oxytocin, the main one, is released by the pituitary and triggers really strong uterine contractions. If a woman is not able to push the baby out, or the pregnancy is taking too long, the hospital can give a synthetic form of oxytocin called Pitocin that's made from pig oxytocin, and that triggers very severe contractions in the female to push the baby out. And so a combination of all these things, prostaglandins, estrogen, and oxytocin, all trigger contractions that are going to push the baby out. Now, you'll notice the baby is head down first, and then all scrunched up and not much room. So the oxytocin is going to trigger the walls to push, and then the baby is going to move down right up to the vaginal wall, essentially, as it pushes out through the cervix. The cervix is the small passageway between the vagina and the uterus, and it starts to enlarge as you're going to give birth. So this is dilation, as it's called. You hear in movies, oh, she's 10 centimeters dilated. That's usually the goal. 10 centimeters is like this. Okay, so it's about 5 inches. So you're trying to push the baby out 5 inches, and the point is that the baby has to come out head first. Okay, because if the baby comes out leg first, the head, which is usually the biggest part of the baby, is going to get stuck, and you can break the baby's neck and cause it to suffocate and have a hard time getting it out, because the vaginal walls and the pubic bones are here holding the baby underneath its chin, so the head has to come out first. If the head is on the top and the legs are first, then we say the baby is breech. If the baby is breeched, then you have to options are, sometimes you can manipulate the baby through the skin. Some people use acupuncture, which is shown to work. Sometimes the doctor can go in to the vagina with their hand and move the baby, cause them to push them and move them. And then oftentimes, if it doesn't work, then you would have to have a C-section. So uterine contractions are going to begin. The amnion is the bag that the baby is floating in with amniotic fluid. This is the breaking of the waters, or in movies you see a woman just, she starts to feel like she's peeing, but really it's the water breaking. In a large number of pregnancies, the amnion doesn't rupture, the bag doesn't break, there's nothing like that. And in the hospital, the doctor will go in with a little prong and poke the bag and cause it to pop to stimulate or initiate labor. Then you have expulsion. The infant passes through the cervix and vagina. Head first is normal, of course. And then after the baby, you actually have to give birth again, this time to the placenta, which usually weighs up to 5 pounds. Crazy, this giant thing of blood vessels. And in some cultures, it's kept and cooked and eaten, although not me. And this is what it looks like. Here you have the baby upside down. Head's going to come out first. And then finally you have the placenta with the umbilical cord attached to the baby that has to also be birthed. Now, once the baby is born or in its final stages, the testes actually form in the abdominal cavity, and then they have to descend, typically about a month before birth. The testes will descend into the scrotum. Sometimes they don't, and then there's a scrotum with no testicles, and the testes are internal. But all this is tied to testosterone. Testosterone, again, is the single determinant of whether you're going to be a boy or a girl. We all start down the female path. That's the generic path, and only if testosterone is produced a month or two into development will the side path be chosen, and you'll go off to be a boy. And this is due to a gene on the Y chromosome called the SRY gene that we men in the know like to call the sorry gene. It makes us very good at saying sorry. So in both sexes, reproductive organs don't function until puberty, thank God. And puberty usually begins at about age 10 to 15, and it depends on the individuals. We do know that puberty age has gone earlier and earlier. It's not entirely clear why. But then you start menses for a female about 2 years after puberty. And women always go through puberty before men do. And reproductive age, the ideal is in your 20s. Mid to late 20s is the best time when your eggs are your healthiest. That does not mean I'm encouraging you to have sex and make a baby when you're in your 20s or earlier or later. All your choice. Menopause. When you get older, all women are going to have to go through menopause. You no longer ovulate. You don't have menses. You don't bleed. You don't have your period anymore. The ovaries stop functioning as endocrine organs as a result, and you slowly decrease your levels of estrogens and progesterones, and mainly estrogens. So your options are deal with the symptoms like hot flashes and feeling crappy and so on, or take hormone replacement therapy, where they give you pills, much like birth control, but they give you pills of estrogen so you can avoid those feelings of hot flashes and whatever. The disadvantage is taking hormone replacement therapy has been shown to increase rates of cervical, uterine, and breast cancer because those cancers are estrogenic, meaning the cells have estrogen receptors on them and it triggers the cells to divide when estrogen is around. So if you're on hormone replacement therapy, you're more likely to get one of those types of cancers. And for better or worse, there is no equivalent to menopause in men. In men, there is a decrease in testosterone over time, but there is no tie to menopause. Men can have babies until the day they die. That's just weird, I know. And we're done. And on that note, placenta!